Okay, so the discussion was the effects of myofascial release techniques combined with core stabilization exercises in elderly with non-specific lower back pain. Did you get through the article?
Wasted?
Did you get through the article?
Yes.
All right. What did you think about it?
I think the article is about pain and low back pain mostly.
Yeah, no, it is, and I also think during the study or the study, it's showed that people who had core exercises as well as the back roller, seemed to help their pain a little more, or not pain. Actually, neither exercises and back roller helped pain. It really showed that it helped with them get more range of motion. So it loosened up the muscles to allow them to move and have more flexibility, but not so much relieved any pain. I also felt like the sample size was really small and that they could have used more participants. Um, if you look at the p values, which they're at 0.5 for some of the statistics of the data, and that is pretty insignificant when you look at it. So I don't think there was enough of a large enough of a sample size to properly get good results. So I think if they did it again, a larger sample size would be needed, more participants, more people involved. But I think ultimately it showed that with core stability and using the foam roller after they did the workouts and engaging their core, they were able to see better results in range of motion. Unfortunately, not a reduction of pain in either group. But those who just did the core stabilization alone didn't get the same effects and benefits. So, I mean, I guess working those muscles and getting them warmed up, but properly cooled down after, and the foam roller really releasing the tension of those muscles kind of helped stretch and gave them that range of motion and flexibility, which seemed to be good and seemed to help them versus just working out. So there's that, which seems good. What do you think?
I think what you said is right. Like some people do have back problems, and they use mostly rollers to help them with their muscles and their spinal cord.
Mm-hmm.
Mostly they use a roller, or they usually try to have a chiropractor to help them align their spine if they have like fitness or if it's like slanted point.
Yeah. I don't think I didn't see in here where they dealt with chiropractors too much. I mean, I know it was really a lot about the immobilization and then the foam roller that I saw. But apparently, core stability exercises alone are not gonna get you there the way just the proper cool down well after a workout. Did you have any questions or things you want to add, or how you could apply it to everyday stuff?
Yes.
What was that? Did you have any questions or anything like that you want to add?
No, not that I know of.
Uh, no, I definitely think it would be better and more beneficial for people to probably start with a daily exercise regimen at an earlier age instead of the later age. I think while it helped with the range of motion for everybody, or for the group that both did the core stabilization and the foam roller, it didn't help in the reduction of pain. I think preventing that in the first place by starting at a younger age and really working on your core stability and strength would probably have prevented that in the long run for a lot of these people. And I think we see that in the chapters and the discussions that we do. A lot of people see disc degeneration and bulging discs and spine problems, which cause a lot of issues, and then the breakdown of the muscles as we age. And I think a big component of preventing that would be to begin your exercise and begin your stuff early on in life to avoid any of those issues later on. I think if we implemented both the core stability exercises and the foam roller techniques at a younger age, we'd probably see a lot of reduction in pain and more flexibility and movement in the elderly, and I think that would help. I think that would help them significantly. I know that I see a lot of elderly people who can't do much for themselves, and I think a lot of that just comes with sitting down and giving up and having a more a less active lifestyle, I guess I'd say. I don't know the word I'm looking for, but yeah, they're more sedentary. Yeah. And I think that ends up hurting them. I think both, even just adding the exercise alone, I mean, it was saying people felt better. Anything you want to add?
Let's see. There's some like an article that some people do exercises on the ball to help them with their core stability, and like there's a type of exercise for them to do to like relax their spinal.
I think the ball is to just help them engage the core because they have to use their core to keep themselves steady and on the ball. So I think it's a good technique to use. There's also that it's like the half ball, and it's got the flat base with the half ball on it, and it's soft at the gym. You can use it to stand on to kind of help with your core stability, or you can turn it onto the ball side and use the flat side to put your hands on and do push-ups with, which also helps with both shoulder stability and core stability. I think implementing stuff like that would also have been beneficial to them. I know given their age and stuff like that, it might be more difficult, but adding some weights, especially cable weights, because a lot of cable weights can help keep you or engage the core. So they can do exercises like even just everyday stuff that can help is carrying milk jugs. You know, it's like a farmer's walk. They'll carry a milk jug in each hand and walk a distance and set it down. Maybe turn around and do some lunges if their knees permit, but I feel like a lunging motion will also help with that stability. and it'll help keep their knees and their hip joints and hip flexors active and engaging in the workout process as well, which will help them in the long run. Do you think there's any other exercises they can add to assist?
I don't think there's other exercises that I know.
But yeah, I think a larger sample size would be beneficial to really see how this makes changes. But yeah, the results, it was found that the improvement in core stability and endurance with the p-value of 0.031, which is pretty significant, and the spinal mobility in the sagittal plane with the p-value of 0.01 or 0.022, which is also significant, supports the theory. And that was greater in the people who did the foam rollers. So yeah, but it said there's no significant difference between the two groups in terms of pain.
So one of the question is, if you were to conduct more research based on the findings of the article, what would it be?
Like I said, I think a larger sample size would definitely be better. Maybe starting from a younger age and following them longer, and then going and seeing if not only we could prevent a lot of the issues that people who didn't do any of this stuff at an earlier age have, but if we can almost put a stop to it altogether, like people who have a family history of arthritis or kyphosis or things like that, or degenerative disc disease. I mean, I know exercise alone isn't going to be the big component. Diet, exercise, and lifestyle changes and everything play a key role. But I think if we start maybe a study group of people in their 40s and then go until they're, 50, 60 years old, it would be a long-term study, of course, but I think if you start them in their 40s and really do core stabilization and things like that from 3 times a week is what they said they did, and just keep it up for the rest of their lives, I think you would see a huge improvement in a lot of elderly people's spinal issues, mobilization issues, just market improvement in a lot of things. What do you think you would change or add to the study? Like, if you had to conduct more research based on the findings, what would you do?
Probably tell the people, like, hey, try to do the best that you can, not to like destroy your back or anything. Like, try to do like less weight. Like, they have trouble bending, so I still think they like